Hi, I'm Hope Witkowski, your host of Senior Scene. Have you ever been mesmerized by somebody's beautiful white smile when they came up to see you? And you're thinking, maybe it's time for me to go see a dentist. Well, that beautiful white smile may be part of your personality, but there's other health benefits related to that. Many of you might think, why go to the dentist if I'm brushing my teeth every day and my smile looks great?
Regular dental checkups probably are very, very important for preventative purposes. As you know, prevention is the key to health. And so with dental checkups, we always start out with radiographs or x-rays that we look at the hard tissues of your teeth with the x-rays. We'll look at the bone. We'll look at your teeth. We'll look for decay in between your teeth, bone loss, or abscesses inside the bone. And the next thing we do is like a thorough oral exam. We'll check your teeth, verify what we see on the x-rays on your teeth, and we might see decay on your chewing surfaces and stuff like that. And then we'll do like a soft tissue exam. We'll examine your gum, side of your cheek, on the floor of the mouth, your tongue, the back of your throat. We'll look for any abnormalities or evidence of early stages of oral cancer.
There are many ways that you can take note of your teeth and gum problems that would signal you need to see a dentist sooner rather than later.
Periodontal disease is basically like a silent disease. It really has no symptoms. Initially you'll eat fine, you're fine, but as time goes on, you'll notice maybe there's a little bleeding in your gum, or maybe your teeth become more sensitive to like cold or sugary drinks or something like that. Then you think, uh-oh, my tooth is kind of getting sensitive. I ever go see my dentist. I think that's when you should go see your dentist. If you notice any kind of bleeding, inflammation of your gum, or sensitivity on chewing or drinking things, I would visit your dentist and have your gums checked out.
Joanne, a patient of Dr. Hashimoto, shares her dental hygiene routine.
Brush morning and night for sure. Sometimes at work we didn't have the time on our lunch break. But I always chewed the sugarless gum because the xylitol is supposed to help prevent cavities, and I make sure that I floss.
And just as important as her home routine, visiting the dentist regularly is just as important.
I always made sure I went to the dentist twice a year for the cleaning and checkup, made sure that I flossed to keep my gums in good condition.
Joanne didn't know that she had some bad habits until Dr. Hashimoto called it to her attention at one of her routine visits. If it was not diagnosed, could have caused her to lose some teeth.
I didn't know that I ground my teeth till about 5-6 years ago, and the acid reflux is only recently, within the last year or two, that I became aware of it as a problem.
Dr. Hashimoto told her that she was wearing her teeth out and it could potentially wear down on the nerve and fracture her teeth.
Joanne's been a patient of mine for a long, long time. She's been a very good patient. She's very conscientious about her teeth, and I know that. And she was a nurse, and she deals with the public, and she smiles a lot. So I noticed, she had a grinding or clenching habit. So I recommended a night guard because her teeth were wearing down. And recently I asked her about, I noticed that her enamel was wearing away, especially behind her front teeth. And I told her that, your enamel is completely gone. I could see the nerve through your tooth now, and I recommended a crown.
It is important for us seniors to note that there are some basic challenges our teeth get as we grow older.
The most common problem is periodontal disease or gum disease. Periodontal disease is the #1 cause of tooth loss. And so it's very common as you get older, like heart disease or cancer. As you age, the incidence of getting periodontal disease increases. It's never a disease of the young, rarely.
Dr. Hashimoto says gum disease isn't anything new, and patients should know it's preventable and oftentimes avoidable.
The periodontium in dentistry composed of basically the gum, the bone underneath the gum, and the periodontal ligament, which holds the teeth or the roots in your bone. So basically those are the three main components of gum tissue that holds your teeth in your mouth.
If we see our dentist twice a year, what are the steps we can do for our healthy teeth in between those visits?
My feeling is, when you brush your teeth and floss, after every meal is probably the best answer I could give you as far as when you should brush your teeth. I think after every meal you should brush your teeth, because as you age, your gums recede, your teeth, maybe your gums become more sensitive. There's areas where food may get trapped and lodged, and if you don't brush your teeth periodically or after every meal, that food might get stuck in there, and if it sits there for any length of time, it'll start decaying your tooth. The ideal floss is unwaxed floss, but I don't like it. I don't prefer it. I don't recommend to most patients because it's not very comfortable to use. I recommend like a wax type floss, and you gotta you don't just push it in. You kind of give it like a sawing action, and once it breaks through the contact, then you cup it into like a C shape along your tooth, and you rub it up and down about 3 times one way, and cup it along the other side of the tooth on the other side of the contact area, and up and down 3 times, pull it out and go next. People are all different, and they chew differently. Some people are very, very aggressive chewers. They'll just bite into things and not even think. And some people are very conscientious about their teeth. They said, well, maybe there's a piece of bone in my food, or maybe the peach pit is right close to where I'm going to bite. So they're very careful biters or chewers. So, I would just, as far as you age, I know teeth become more brittle as you become older, similar like bones. And so I would say to patients, as you get older, you have to be very careful on chewing your food because teeth tend to break or chip or crack.
Bob Herbert is another patient of Dr. Hashimoto and is proud of his teeth.
I'm 84, touching 85, and I'll never stop seeing him at dentist. I see him twice a year for cleanings, and so we're on top of it all.
For this spry 84-year-old who has always been pretty good about taking care of his teeth, he was surprised to find the doctor had a few concerns.
My jawbone was deteriorating somewhat, and when you start to do this, you have bleeding gums sometimes, and so Dr. Hashimoto recommended I go see the periodontist, and that's what happens. I think I probably had 5 implants. The first one didn't take. The doctor had to do it 3 times. And they do a procedure, what they call, when your jawbone is deteriorating, they insert cow bone before they can put the implants in. And that didn't take right away.
As a young child, he didn't see a dentist, but finally, seeing a dentist after having many, many cavities resulted with his implants, crowns, and bondings, which now keeps Bob's smile one that is infectious.
I wasn't never a big follower of flossing. And when you learn that flossing is a big part of your dental problem, it does a lot of things. You don't run into the problems like you do if you don't take care of your teeth. So that is what I would say. Very important.
Another problem as we age is that our teeth begin to shift in our gums.
When teeth are crooked, one, it's more difficult to keep them clean. And when you don't keep your teeth clean, the plaque and the bacteria build up. You end up with periodontal disease, that's gum disease, and you end up having gum loss and bone loss, and sometimes that could lead to tooth loss.
A dentist can perform many procedures to help us keep our own teeth throughout our life. Many may have had experience with an orthodontist in their younger years, but how about after age 50?
For most adults, the reason they don't want to do braces or straighten their teeth, one, they think they're too old for it, which isn't true. You can take care of your teeth at any age. But the real reason is they don't want to wear braces. They're not 13 years old. And they just don't like the idea of wearing braces. And so orthodontics has come a long way, and we have Invisalign now. So believe it or not, these teeth have Invisalign retainers. So you could take someone with crooked teeth, and through Invisalign you can straighten their teeth, and very few people can tell. Their teeth might look a little shinier, but no braces, very simple. And in terms of people who do have some beginning gum disease, you take these Invisalign aligners off, and you can brush and floss very easily and get straight teeth without having to have braces, and with being able to keep maintain the cleanliness of your teeth so they'll be healthy. Well, let's first talk about the number one reason why people lose their lower front teeth, which are noticeable. And the reason is root proximity. When teeth get crowded, the roots get really close together. And when the roots get really close together, there isn't enough bone in between them. And when you have reduced amounts of bone and the bone's already thin down there, you don't have a good blood supply. And when you don't have a good blood supply, you lose bone. The bone resorbs. And when you lose bone, you eventually lose teeth.
Thanks to technology, a new type of braces can be worn during the day with no one ever knowing.
Prevention always is the key to good health. And I think dental checkups are a very important part of that. And when you do go see a dentist for regular checkups, we always start out with radiographs or x-rays to check the hard tissue, your teeth and your bones. Then next thing we do is a complete oral exam, do oral cancer screening, we'll check your teeth, we'll check your periodontal health. And the third thing we do is called prophylaxis or teeth cleaning. And with the teeth cleaning, we remove the hard deposits on your teeth, stains, and then we polish your teeth to give it that smoothness and shine to make your teeth smile, look good while you smile.
I hope you learned a lot from today's show. We heard from our dentist and our orthodontist and saw 2 patients who had problems that were resolved. Remember, you need to see your dentist at least twice a year. I'm Hope Witkowski reminding you, knowledge, it's a powerful tool. Remember to keep smiling and tune in next time for more secrets on successful aging.